But Katherine, please go ahead and share what you want.
Okay, great. So, so this is Public Health 101 because this is just barely touching the tip of the iceberg. But so, I'll talk about that in a minute. Also, I have a whole bunch of slides with a lot of information. It's not all the information that I'll talk about, but this is kind of a work in progress. I got most of it, but I didn't quite get everything that I wanted to. But because I'm redoing it, I'm going to add all this stuff. So we'll send out the link through Leaf Society, but I'll keep adding stuff. So it's a work in progress. So I went to BYU and I got a BS in exercise science and I minored in modern dance and psychology, and they both have a huge impact on my practice as a physical therapist, which is kind of interesting, but I love it because it's all kind of come full circle. Then I went to Rutgers in New Jersey for my master's degree because Gordon was at Princeton getting his PhD. And then I worked for 3 years and did pediatrics. And then I stayed home with my kids for 12 years, and during that time I became a birth doula with Dona International. And then in 2010 I started working again as a PT and switched specialties to pelvic PT, and it was like 2 years of like, oh my gosh, what am I doing? But you know, I just kind of, I did it, and I carried a clipboard around like this, like to every patient, and but it worked out, and so I've done it for 13 years, and I just absolutely love it. So, just
what is exactly a doula?
So a doula is a non-medical labor assistant. So a birth doula helps a mom during labor.
Like a midwife?
No, midwives are the medical care providers. Oh. So the midwives are the ones insured for the physical health of the baby and the mother during the birth process. Doulas are emotional and physical
like
massage.
Remember when you screamed at Larry
support.
when you were in labor and you're like, why'd you do this to me again? She would be the person like, Larry, you should go get some water. I'm here to support Larry for a minute. That's
So So great question. And then there are postpartum doulas that are just there to do any task and help with the baby and while you sleep. And so it's basically doing anything you can to support a birthing mom, either during labor and birth or after, in the early postpartum period.
And is this a volunteer or people paid?
So people get paid for it. So I've only ever done it as a volunteer, and I was a part of the Hearts and Hands volunteer doula program at UC San Diego, which was where I did most of my births, but I've done some private clients too as well. But so anyway, but it's all about birth and it just ties in so much with women's health and pelvic floor PT. So anyway, so pelvic health PT started in the 1970s. It was brought over from Australia by Elizabeth Noble, who was an Australian PT, and it was called OBGYN PT. And so, you know, it was treating conditions surrounding pregnancy and childbirth. And then they realized, oh, wow, we can treat more things than just OBGYN conditions, so it was changed to women's health PT. And then we realized, oh, guys have pelvic floors too, surprise, and kids, and so we started treating those, and then it changed to pelvic floor PT. But now everybody realizes, and you will realize by the end of tonight, it's just not only about the pelvic floor, it's about everything from your nose all the way down to your feet. So it's called pelvic health PT because you've got your organs in there too, and it's all about, you know, organ function and as well as musculoskeletal functions. So now it's called pelvic health PT. It should be called abdominal and pelvic health PT because there's all sorts of stuff that goes on in the abdomen that's related to the pelvic floor, but that's too wordy. So it's called pelvic health PT, and it's a subspecialty of orthopedic PT, which is, you know, backs and necks and hips and all of that. So that's that. So as I said, this is just the briefest of introductions to all of these topics. I could spend hours and hours and hours on each slide that I'm going to show you. 101 is just the start. You can dive really deep and you can keep learning your whole life. Like, there are so many things that I don't know. It's just an amazing, amazing field. And these are just some of the highlights and hacks that I think will be the most impactful for you. So my first kind of general overview is work with a design. So this is one of my favorite scriptures, Psalm 139:14. I will praise thee, for I am fearfully and wonderfully made. Marvelous are thy works, and that my soul knoweth right well. So I always come back to that. We are fearfully and wonderfully made. Our bodies are exquisitely well designed. And I'll talk about that in a second. So But something that I really feel very strongly about is body positive language. And so, you know, maybe you guys have heard of that, but just talking about our bodies positively and using phrases and words that build that body positivity. So, because our language shapes our thoughts and our thoughts shape our experiences. And another concept or idea is to use correct anatomical terms. And so we were just already talking about that, especially with your children. You know, historically, our pelvic floor and our perineums and everything, shame, 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 right? And so using correct anatomical terms, it normalizes everything. We all have pelvic floors. Everybody has pelvic floors. It's just part of your body. And I think that's a lot more, everybody talks about it more now, right, than, you know, when I was growing up. But so it's just really important just to call vulva vulva and kind of know, oh, which part's the vulva and which part's the vagina, right? So getting to know our own anatomy and what the terms are. So, and also just consider everything that goes right. When we think of the complexity of our bodies and everything that we do every single day and everything that all of our cells are doing, it's literally, we are fearfully and wonderfully made. And if we just concentrate on all the things that are going right, then, you know, if we are having things that are going wrong, then, you know, it just shifts our focus a little bit. So it's all about, you know, having gratitude. So, if something goes wrong, it's pretty likely that we are not working with the design. I honestly believe that. I honestly, truly believe there's a reason for most problems that we have. Modern life, we know, is terrible for our human bodies. Absolutely terrible. And especially because we sit all day long at computers and we do not move and we have our feet in shoes that are not shaped like feet. It's terrible, right? And so no wonder we have all these musculoskeletal problems, right? What is it? I can't even remember, you know, how many, 80% of Americans have back pain or whatever. No surprise. It's not a surprise, right? Because we are not really working with our design, okay? That said, our design is so good that there are backup systems in place for any system that might not be working at 100%. So things don't have to be perfect, right? Your structure does not have to be perfect in order to have good, healthy function. Does that make sense? So it's not what you have, it's what you do with what you have that matters. And that's one of a phrase that I say to my patients all the time. It's not what you have, it's what you do with what you have. It's how you use and how you move in the body that you have. So we are going to talk about some concepts like biomechanics. Biomechanics are the effects of gravity, force, and pressure on the body. So we're going to talk a lot about that. We're going to talk a lot about intra-abdominal pressure. I'm going to talk a little bit, well, or maybe a lot, about neuroplasticity. So neuroplasticity means that your brain and your nervous system can change. So in the olden days, they thought, oh, you get a brain injury, that's it, right? Now we know, there are all these chemicals and things that can help your brain regrow in different ways, right? It's amazing. It's a huge, you know, lots of stuff going on in this area. So the brain and nervous system can change at any age, So the brain and nervous system can develop bad habits kind of easily, but you can also reprogram it and develop good habits. But it takes a lot of conscious effort. You have to bring your movement into your mind, you have to change it, and you have to practice it over and over again. And so it requires mindful movement, right? And I listened to a audiobook on cognitive behavioral therapy, you know, what some psychologists use for like retraining your brain, right? And the process that they described, it was exactly the same as what we use for physical therapy. They're like, become aware of your thoughts, what happens habitually to your thoughts, and now choose a different thought and then go, right? And so it's the exact same with changing your movement. You have to become aware of your movements, you have to consciously change it, and then you have to practice it until it becomes automatic, right? So that's kind of the therapeutic process. So anyway, we'll talk just a little bit about resilience. So that's the ability of the body to respond to stress. So, you know, we all have stress, but at some point, you know, if our resilience is here and our stress is here, then something's going to happen, something's going to break down, some symptoms are going to start, right? If we are able to build our resilience up higher, then that same level of stress is not going to cause symptoms in the body, right? And so, because stress is good, we have to have stress. Without stress, we die. So stress is a good thing. It's just you want to have your resilience just a little bit over your stress, right? So, all right, so that's resilience. And then also just keep in mind individual uniqueness. So I'm going to talk about really general principles tonight. You might be in the outlier of a condition due to trauma or other factors and require treatment beyond conservative care. Because what I'm going to talk about is conservative care. That's what we do in physical therapy. So I was going to get some chalk, but for example, these are all the people who have low back pain in the world, right? And I said it's so common, right? So right here, all of these people are going to really get better with, all this stuff that we're going to talk about tonight or whatever. But these people here, because of trauma or whatever, or surgeries or whatever, are going to need kind of specialized something, right? Does that make sense? So these are generalized conservative care principles. So, okay, so lots of conditions are common but not normal. These are not normal. Never, ever, ever, ever. They're common but not normal. Stress incontinence. So that's leaking with coughing, laughing, sneezing, leaking urine with coughing, laughing, sneezing, lifting boxes, things like that. Urgency incontinence is where you feel the urge to pee and you leak on the way to the bathroom. Tailbone pain of any type, when you sit, when you stand, whatever, tailbone pain. Pain with sex, not normal at all. Straining to defecate, not normal. Pelvic pain, anywhere in the pelvis, including men, so that's testicular pain, penile pain, any pain, anywhere, we treat all of that. Feelings of pelvic pressure or vaginal bulging. Back pain, rib cage pain, urinary urgency, urinary frequency, hip pain, fecal incontinence, constipation, and surgical scar pain. And that's the most common things that we treat.
Would surgical scar pain be like from a C-section primarily?
Yep, or any scar.
Like
any
like
scar,
hernia.
any scars. So scars are interesting because, okay, what doctor would do surgery on your knee and not send you for PT to get that scar stretched out? How many people have thoraco and abdominal surgery, right? And they don't do anything for the scars. And guess what? I can't now, and now I can't twist. And now I don't have full range of motion in my back because I have this huge scar here, right? And so we end up seeing them years later and do this scar work and get it moving, right? So any surgical scar pain, I should add, or lack of mobility, right? So all scars can be worked on and stretched. The two in green. So because of our group here, the two in green is kind of what I'm going to focus my comments on tonight. So stress incontinence and prolapse, which is feelings of pelvic pressure or vaginal bulging. So, but I'll take questions at the end and we can talk about all that. So pelvic floor muscle problems. And we'll go over anatomy in a minute, but pelvic floor muscle problems. Pelvic floor muscles can be too tight, too weak, or not coordinated with the muscles that they need to be coordinated with. Which do you think is the most common? Raise your hand if you think too tight is the most common. Raise your hand if you think too weak is the most common. Raise your hand if not coordinated with the muscles needs to be coordinated is the most common. Okay, all right, so that's how I would have answered before I started learning about all of this stuff at the beginning of my career. Too tight is the number one problem. 99% of my patients have pelvic floors that are too tight. Too weak is not really a thing, and we'll talk about it a little bit maybe at the end. Well, maybe we'll talk about it soon. Make sure somebody asks me about that later at the end, okay? But too tight causes all of those other things that I saw. It's not too weak, and coordinated is the number two. Okay, too weak is not really an issue, and hopefully I'll explain why. Okay. All right, so in other words, you hear all this stuff about Kegels. It's not only a pelvic floor problem, it's a whole body problem, and we'll talk about that.
Maybe I need to go back to pelvics 101.
Yeah.
I know what a pelvis is, and I know what a floor is. What's a pelvic floor?
Okay, so I'm gonna do that in like 2 slides. I'm gonna do that in 3 slides. Can you hold on for 3 slides?
Sure.
Okay, all right. So, and now I know, I'll put that slide earlier in my next lecture. Okay, so pelvic floor problems are not pelvic floor problems. Pelvic floor problems are full body problems, okay? It goes all the way up from your nose, because we're gonna talk about breathing, to your mouth and your jaw, to your voice box, to your diaphragm, to your deep low back muscles, to your abdominal muscles, to your pelvic floor, and to the sides of your pelvic floor are your hip muscles, and those go all the way down to your feet, okay? So it's not ever only about the pelvic floor. Okay. All right. So all muscles can have these same problems: too tight, too weak, and not coordinated with the muscles that it needs to be coordinated with. And so that happens with all these different things. The low back muscles are usually too weak. The abdominal muscles are usually they're usually too weak down here and usually too tight up here. The hip muscles are usually too weak, the pelvic floor is usually too tight, and then the feet have all sorts of problems. So, all right, so here we go. So now our pelvic anatomy, all right? So, and I'll add some pictures of this. This is my little pelvic model, okay? So these are the bones of the pelvis. This is a ring, okay? We're looking down like this. So your spine comes down here. This is your sacrum, that's your triangle bone right here. And your tailbone is right off here. It's just hooked to the muscles over there. So your tailbone is right there. Right here are the top of your pelvic bones, right here. People say, I'm putting my hands on my hips. Those aren't your hips. This is the top of your pelvic bones. Your hips are kind of in the front, but if you say, I'm putting my hands on my hips, that's where you are. And so then, if you look like this is your pubic bone in the front, and it's a ring, right? It's a ring. So our pelvic, it's called a pelvic girdle. It's in a ring like this. And the bones move. There are joints. There's a joint right here, and there's a joint right here, and a joint right here. So these rings, this moves. And so it has to have a lot of muscles all around it to stabilize that movement so it doesn't, so you don't fall over. If it's not stabilized, you couldn't stand up, okay? So, and then also, if you stood up and didn't have anything there, your organs would fall out to the floor, right? So we have muscles right there, and they're called the pelvic floor muscles. So this is what the pelvic floor muscles look like, okay? So they're not a floor. A floor would be flat, right? So this is like a bowl or a hammock or a dome or a diaphragm. There are all these different words for it, okay? But when we're thinking about it and practicing some of these exercises, think of it this shape, okay? It's not flat. It's not flat like a floor, okay?
How does it go in the?
I'm going to show you. Yep. So it goes right there. Right there. It fills the whole space. See? Like that? All right. And so it looks like that from the outside, except there's another layer that I'll show you. Okay, so this is the deep pelvic floor muscles. And there's a left and a right side. You can contract the two left and right sides separately. We're not going to do that tonight. That's an advanced skill. Okay, but so in females, there are three openings. One right there for the urethra, where your urine comes out. One right there for the vagina, and then this one is showing is the anus, where the rectum hooks to and goes out. Okay, so this is the pelvic floor muscles. Okay, so when you squeeze the pelvic floor, when you squeeze, it goes up like this. And when you relax, it comes down, right? Can you see that? If the muscle squeezes, it's gonna go up, okay? It's gonna go up and down, and we're gonna practice this, okay? But that's what they look like, okay? So when we talk about the hip muscles being important, that's this hip muscle right here, right here. Here, I can do it like this. This is a hip muscle right here. And so we're going to talk about how important the hips are. And the reason is that this hip muscle is connected to this edge of the pelvic floor. So they work like a team. They're neighbors and they work like a team. And so if your hip muscles are weak, which most people's are, this hip muscle in particular, called the obturator internus, then your pelvic floor is going to get tighter and take over the hip muscle's job, okay? That's why everybody's pelvic floors are tight. All right. So that's the deep layer of pelvic floor muscles. Sometimes you'll hear it called the levator ani because it lifts the anus, okay? So deep pelvic floor muscles. And they all have names. There are three main muscles and they have names. And when I took anatomy at BYU, did we learn those names? No, we did not. When I took anatomy in physical therapy school, did we learn those names? We did not. We skipped over this. Skipped over this. How, like, this is such a critical part of your body. You're like, oh, we don't need to learn the names of those muscles or where they start, or, you know what I mean? It's crazy, right? So now they do. Now in PT school, everybody learns all the muscles and knows them. So, but it's just kind of, change happens slowly, but we're getting there. So, okay, so those are the deep pelvic floor muscles. So there's an outer layer called the superficial pelvic floor muscles, and those fit right there. Those fit right there. And these are the more, the sphincters, okay? So there's a circle of muscle here, that's your urethral sphincter that shuts off the flow of urine. And then this is your anal sphincter, right around your anus right there, okay? And they crisscross right there. It's called the perineal body. And so that's what happens with episiotomies or perineal tears. That's where those tears happen, right in there. So that's the pelvic floor anatomy, all right? If you, I'll just show the two now. If you cut us in half, and look this way. Okay, this is the pubic bone right here. This is the tailbone right here. And so the muscles are like a hammock in between the pubic bone and the tailbone, like this. And so then there's that opening for the urethra, the opening for the vagina, and the opening for the anus right there. And there's connective tissue in between those organs, okay? The other thing I just want you to notice here is that this is the bladder, this is the urethra, and they form like a 90-degree angle. The bladder and the urethra form a 90-degree angle, and we'll talk about that later. This is the uterus, and this is the vagina. They form a 90-degree angle, like this. Okay. No. All what we're gonna talk about this. Yeah, we are gonna talk about this.
So
Yeah.
at all ages, you cut this person in half, young, old, they all look like that?
So this is the textbook. With vaginal births, with pregnancies, things might be a little bit different. You can have different orientations of your uterus, retroverted, stuff like that. Those are generally the exceptions out on that side, but we're going to talk about how posture affects this. Okay, that's going to be our big take homes, is how posture affects the position of the uterus and the bladder. Okay, all right. So everybody stand up.
But I had a quick question. Is
Yeah.
the colon in the rectum still that 90-degree angle as well?
That has a 90-degree angle the opposite way, actually. So what happens is the muscles loop around. It's called the anorectal junction right back there. It loops it around, it pulls it forward, and so there's a 90-degree angle between the rectum and the anus, and that helps with fecal continence. Okay, so great question. It's the other direction. So, all right. So everybody, put your hands on your booty. You're gonna find your sits bones. Okay, bend. So when you're sitting on your chair, okay, right in there. Those are your sits bones. Okay. So this, remember, your pelvic floor is right here. Okay, so walk your fingers in a little bit from your sits bones, right there, and feel your pelvic floor. Okay, and do a little squeeze. A squeeze sometimes is called a kegel. Okay, so that's lifting, right? The squeeze lifts and tightens the muscles a little bit. Okay, now come from the front. Okay, you're going to feel your pubic bone. So your pubic bone is right here, right? It's that hard bone, and look how wide it is. Do you see how wide it is? It's about 2 inches wide, okay? So you're gonna take your fingers, walk them down, 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 walk them down until you feel that notch right there, you feel that angle, okay? Walk over and you'll get into your vulva, right? You'll go across your clitoris and come right under there. That's your, okay, right there. Take your other hand, put it on your tailbone, okay? Put it on your tailbone, walk it down, walk it down, walk it down, walk it down. So that's the front and the back. Squeeze, squeeze, and see if you can feel it there, in between your pubic bone and your tailbone. Okay, so that's where your pelvic floor is. Does that make sense? It's in between those 4 points. Okay, all right, awesome. Sit down. No, you're good. That's your pelvic floor. And dudes have them too, just the same place. Okay, so here is how these muscles move in relationship to each other. Okay, so the big 3 are the diaphragm, the abdominal wall, and the pelvic floor. Right, and all 3 of those have to work and be coordinated together. Right. Okay, so diaphragm moves like this. When you inhale, it moves down, and when you exhale, it moves up. So don't listen to the. Oh, there we go. Okay. Oh. There we go. So that's inhale. That's exhale. That's inhale. That's exhale. Inhale, it moves down. Exhale, it moves up.
So it's making room for the air.
Inhale, it moves down. Exhale, it moves up. It is stuck to the bottom of your lungs. And so when it moves down, it pulls your lungs down. It creates a vacuum inside your lungs, and the air flows into the vacuum. It's a pressure change, right? So it's negative pressure and the air flows in. Okay, so that is inhale, it moves down. Exhale, it moves up. Inhale, it moves down. Exhale, it moves up. Okay, now looking from below. Inhale, it moves down. Exhale, it moves up. Inhale, it moves down. Exhale, it moves up. It sometimes seems really backwards, right?
Yeah.
But this is what it does. Inhale, it moves down. Exhale, it moves up. Inhale it down, moves down. Exhale, it moves up.
Now,
All
it's
right.
different. You always hear about when you are singing to sing.
With your diet, yeah.
So
So,
right,
well, it's
and
changing.
that's so we're gonna touch on that a little bit. Okay. We'll touch on that a little bit. Okay, but picture that, okay? The dome is going down and up. So take your hands, put them in front of your diaphragm like this, okay? So you don't have to do it with me, but I just want you to inhale. And as you inhale, I want you to flatten your hands like this. And then exhale like this. So I want you to model with your hands with what your diaphragm is doing, okay? You don't have to do it with me, just as you inhale and exhale. I want you to feel with your hands what your diaphragm is doing. So make it like a rainbow. Make it like a rainbow like this, then flatten the rainbow, and then up like that, okay? So inhale, it moves down. Exhale, it moves up. Inhale, it moves down. Exhale, it moves up, okay? All right, now the abdominal wall. So when your diaphragm moves down, your organs are there, right? So your organs have to go somewhere. So your belly moves outward, okay? So when your diaphragm moves down, your belly moves outward. Okay, so put your hands on your belly. And once again, just feel that inhale and exhale. So as you inhale, it moves outward. As you exhale, it moves inward. If your diaphragm's moving, if it's not moving, then your belly's not gonna move, okay?
And if it's not moving, you're dead?
If it's not moving, you are breathing with your chest muscles and not with your diaphragm, okay?
This is where the singing
Uh-huh.
connection comes in.
I never
Exactly.
did get it, no,
Yep.
I mean, no offense to those choir teachers,
Uh-huh.
but I never did understand it.
Yep. It's a lot, and it's a really complex interaction, and but these are just kind of these are the basics. There's, you know, my colleague just took a 3-day class on breathing the diaphragm, three full days, so it's complex, and fearfully and wonderfully made. Okay, so inhale moves outward, exhale moves inward, all right? And so now the pelvic floor is down here, okay? So as your diaphragm moves down, your pelvic floor also moves down, because remember, they're on top of each other like this, okay? And this is biomechanics. This is the pressure change makes it move, okay? So put your hands like this, and as you inhale and exhale, hands go down and up. So inhale, goes down, exhale, it goes up. Inhale, it goes down, exhale, it goes up. Inhale, it goes down, exhale, it goes up, all right? So sometimes these three things together, I didn't get a graphic of this. Well, you can kind of see it. Sometimes the diaphragm, sorry, I'm going in front of the camera. Sometimes the diaphragm, the abdominal wall, and the pelvic floor are called the canister. Then you also have your low back muscles here. So can you see how this is kind of the top of the canister, this is the front of the canister, this is the back of the canister, and that's the base of the canister, right? So sometimes it's called the canister, you might hear that. But then, is this really the top? No, it's not really the top. The top is your voice box, because you can tighten your muscles and shut off your airflow, right? And then that creates downward pressure all the way into your pelvic floor, okay? So we'll talk about that a little bit, but remember that it goes all the way up to your glottis, which is the top of your air pipe, the top of your trachea, okay? So when you hold your breath, you're closing your glottis, okay? All right, so this is a picture of what happens. All those three things together. Just watch them one at a time. Diaphragm goes down and up. So that's inhale and exhale. Inhale and exhale. The abdominal wall, outward, inward. Inhale, exhale. Inhale, exhale. Inhale, exhale. And the pelvic floor goes down and up, the same as the diaphragm. Inhale, exhale. Inhale, exhale, inhale, exhale. Yeah? Isn't that cool? Isn't that so cool? I know. Okay, So now we're gonna feel this, okay? So we're just gonna share and take turns on the balls so we can kind of just spread them out maybe in the back. So we're just gonna have to take turns, okay? And what you're gonna do is, and if you can also do it on a chair. You can do it on any soft surface, okay? So you're just gonna put your legs nice and wide, and you're gonna get your perineum, your vulva, on this ball, okay? And you are gonna feel. You're gonna breathe in, and you're gonna breathe out. You're not squeezing, you're not doing anything, you're just feeling, okay? As you inhale, can you feel a little bit more pressure into the ball? And then as you exhale, the pressure goes away. It's very subtle. It's very subtle. It's like millimeters, right? So you're just feeling, okay? What happens? What happens? What happens as you inhale and exhale? So we'll take turns, you know, as I go through the next slides, you kind of just shift around, make sure you get a turn on a ball, but you can also do it on a chair. The chair is pretty soft, okay? So just get that contact on your pelvic floor right there and just feel what happens, okay? Then I want you to clear your throat and see what happens. Is it going down or is it going up? I want you to cough. Is it going down or up? And if you have a big sneeze, is it going down or up? Okay? All right. So you just observe it to yourself. Here's a ball. Somebody want you to come use a ball. All right.
What if you feel a lot in your abdomen?
What?
What if you feel a lot here?
And don't feel a lot in your pelvic floor. So we're gonna add some exercises that might help you feel it better, but it might mean that your pelvic floor is tight and it's not moving in response to your diagram. Okay, and so that's what I said, it's the number one problem, right? That our pelvic floors are just here and they don't go anywhere because they're holding us together because our other muscles aren't doing their jobs. All right, so everybody make sure you take a turn on the ball and do that, okay? So, and this is how we think when we're talking about, yeah.
Am I supposed to feel our pelvic floor on the ball?
Well, you feel it like
It is what it is.
pressure.
But that's what
This is, okay, I'm gonna keep talking, so just kind of just observe quietly. All right, so what is happening to your pelvic floor when you sneeze, when you cough, when you land from a jump, when you're doing jumping jacks or on the tramp, when you yell, when you sing, when you blow your nose, when you lift a heavy load? What is happening to your pelvic floor? Is it going down? Is it going down? Is it going down? Is it going down? Or is it going up? Guess what? It's not supposed to go down. So let's go up, okay? So that's why we're here, okay? So, here we go. So this is inhale, exhale, inhale, exhale. Remember, inhale, exhale, inhale, exhale, okay? This is not healthy, okay? If you squeeze here and hold your breath and the pelvic floor moves down instead of moving up. Can you see the difference? Okay, the pelvic floor is always supposed to go up whenever you are exhaling and whenever you are doing anything that increases your intra-abdominal pressure, which was all those things, sing, yell, jump, all that type of stuff, lift a heavy box.
Okay, I got it.
It's supposed to be like this, yeah.
So it goes up when you exhale,
Correct.
but I thought when you exhale, your floor goes down, 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 down.
When you inhale,
Inhale.
your floor goes down.
Okay,
Uh-huh, so right here, yep, everybody with your hands. As you inhale, it goes down. Remember, because it's weird, because you think the diaphragm's backwards. Right, exactly, that's why this hand is so crucial. Your diaphragm goes down when you inhale, your pelvic floor goes down when you inhale. Does that make sense?
When you're coughing, you're exhaling,
Exactly.
so your pelvis goes down.
Whenever, look, So, okay, all of these are exhaling, unless you're holding your breath if you're landing from a jump. All of these are exhaling, right?
And exhaling means up, up.
Yes,
Should be.
yes, should be,
Exhale,
yes.
diaphragm up.
Yes, yes,
Okay.
yes, yes,
So
exactly.
it
It
means
should be
backwards,
going
means backwards.
It should be going up. Does that make sense? But what happens is we squeeze the wrong muscles and so the pressure goes down, right? That's no bueno. Or you hold your breath, and if you hold your breath, that can also make it go down, okay? There are exceptions to this, but that's for CrossFitters. Not for most of us. All right, there's a way to hold your breath safely. We're not doing that. That's advanced. That's pelvic floor 501. All right. All right. So that's your huge take home. All right. So now we see the chicken. All right. So this is my intra-abdominal pressure control chicken, okay? So this is the diaphragm, this is the pelvic floor, this is the abs. What happens if you cough or sneeze and oh yeah, that's why we're here, ladies. Okay. All right. Okay.
Where'd you get that?
Yeah. It's just the rubber chicken toy. I know. Isn't that great? Got him in a class I went to. Okay. So yeah, the best visual aid ever, right? So
we all relate to.
right. Okay. What happens if you squeeze in the middle? That's better because some of the pressure goes up and some of the pressure goes down. But what's best? Squeezing from the bottom, and then the pressure goes up. That's what we want. That's what we want. Okay. All right. Okay. If the pressure is going downward over time, that can cause prolapse or urinary leaks. Okay. And a list of other things, but we're just doing that. Okay. So now there's please.
If you have a weak pelvic floor, does that make you more at risk for getting UTIs?
Weak or tight?
That's a great question. I would need a lot more information, but the average answer would be no, because usually tight pelvic floors cause UTIs because you're tight and then you're not getting blood flow and circulation, and so and you're not emptying all the way if your pelvic floor is tight. So usually it's a tight pelvic floor that would contribute to UTIs. So there could be some special unique situations, but that's in general. Did you have a question? Does somebody have? Okay.
And tight pelvic floors is the thing you don't want.
Correct. What you want is, so for a muscle to be healthy, it needs to be strong, it needs to be flexible, and it needs to be dexterous. Like you need to be able to do, right? So the same goes with the pelvic floor. You want it to be strong, you want it to be flexible, and you want it to be dexterous, meaning you're not only turning it on 100% and turning it off to 0. So strength is not bad, but if you have strength without any flexibility, that's bad. At any muscle in the body, including the pelvic floor. Does that make sense? Mm-hmm. Strength is not bad, but it has to be balanced with an equal amount of flexibility. Because if it's tight pelvic floors, means that it's on all the time and it never relaxes, right? Relaxation is just as important as strength, right? Okay, so now this is the posture hack. Okay, so we're gonna practice a little bit how to control your intra-abdominal pressure with squeezing your muscles, but that takes some practice. But if you remember the thing that we're gonna do now, you don't even have to ever do this. Okay, so this is the hack. All right, this is the hack. So here we go. So remember how there's a 90-degree angle right here and a 90-degree angle right here, okay? So just imagine that somebody sneezed or coughed, right? And they're not squeezing correctly, no big deal, right? The pressure comes down, okay? The pressure comes down. So I'm gonna exaggerate. If you are standing like this, which is called a posterior pelvic tilt, okay, what happens is the uterus flips backward like this, and the bladder kind of flips backward like this because of biomechanics, because of gravity, right? And now they kind of line up over the vagina and the urethra, right? So then, if you're sneezing, coughing, lifting babies, whatever, blah, 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 the pressure, they're gonna fall down, right? Or the urine is gonna leak out. Okay? If, I'm exaggerating, you do an anterior pelvic tilt like this, okay? Then, guess what? The bladder goes like this, the uterus goes like this, and then, if you have pressure coming down from the top, it kinks the urethra and shuts it off, so no urine comes out. And the uterus comes down and falls on top of the pubic bone, and it can't go anywhere, right? So if you're like this and your organs are over your vagina, guess what? Leaks and prolapse. If you are like this, it goes over your pubic bone, no leaks, no prolapse, okay? Okay, this would put me out of business if everybody knew this, okay? But the problem is, it's hard to do, but we're also gonna practice this on the vault, okay? So, the problem is that when you go to sneeze and cough, your body goes, right? Now, what are my organs lined up over?
Yeah.
My vagina, okay? So then you're gonna feel that downward pressure, all right? So what you have to do when you sneeze and cough is do the opposite, and we're gonna practice pelvic tilts in a bit. But you go like this. You lift your tailbone as you sneeze and as you cough. Now this is not great with COVID, right? So, right? But it will change your life, okay? So you sneeze and cough like this, and your organs will not go anywhere, okay? This happens all the time to me in the car. I'm driving and I'm like, and I'm like, oh crap, I can feel my pelvic floor bulging into the car seat, right? And then I feel more coughs coming up. No movement. You don't feel a thing. It's literally amazing. But you have to remember, and I don't even remember, and I've known this for years, right? So it's all about being mindful in your movement, right? What is happening when that pressure is coming, okay? All right, so that is the posture hack. Okay, so I'm gonna keep talking, but I want you to come and sit on the balls. Yes?
I have a question. Does that help if you have the urgency, to go and you're having trouble holding it? If you move to that position, is that going to help you,
That's a great question.
What is that going to be?
That's a complicated question because the urinary urge means that your bladder walls are contracting, are kind of squeezing. And so there are two other things that are more effective.
Okay.
There are two other things. This will make it more likely that it won't leak, but it won't take the urgency away. Does that make sense?
So
Okay.
walk to the bathroom like that.
Amen, sister. Amen. 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 Yes. Okay.
But so just so
Alright.
I'm clear, like when with
Yep.
that posture, like your pelvic should be tilted forward.
So we're gonna work on that in just a minute.
Okay.
Okay. So what I want you to do is I want you to just take turns again on the balls or on the chairs. Okay. While I'm talking, while I go on, I want you to practice like flattening your back like this and cough through your throat, whatever, and see what happens. See if you feel it. Then go like this and do the same thing and see if you feel it going down or not. You won't. Okay. All right.
Like this.
I've been doing it on the chair, but what I really think
Yeah, so don't cross and don't like that's my
So your spinal erection should be on.
So you're arching your back as feel it. Sorry. So if you flatten your back, no bueno, you'll feel that downward pressure. If you arch your back, bueno, okay?
Yeah.
Flatten your back, no good. Arch your back, yeah. Flatten, no good. Arch your back, good. Flatten, lines your organs up over your vagina. Arch, lines your organs up over your pubic bone. That's what you want. Does that make sense?
So that pressure is going onto your pubic bone versus.
They won't go anywhere. Your organs will not move. And you will not move. Does that make sense? That's why this is the hack. This is the hack.
matter how
That's the hack.
you're phenomenal.
So, can you ask me that a little bit later?
Oh,
Okay, we're gonna do, okay. All right, so, all right.
You just keep going. We're all happy.
Okay,
So you need to practice that?
yes, because it has to be mindful, right? Just like I said, I'm driving in the car, cough,
I mean, even
bulge,
practice
oh
it when
no,
it doesn't happen.
like this.
Like,
Well, yes, you should. Yes, you should practice so that you're ready for when it happens, yes. And we'll talk a little bit more about that, but yes, it's a great thing. Yes, practice it, practice it, practice it, practice it. But your body wants to go because your abs squeeze and your abs want to flex your spine, right? So you have to learn how to squeeze your abs and cough without flexing your spine. So, all right. So,
But your spinal erector should be engaged, right?
what?
Your spinal erector should be engaged.
No.
They should.
So, no, we're going to talk about your multifidus. No, I do not care what your erector spinae are doing. You want your multifidus, which is deeper than your erector spinae, okay? So I'll tell you why. But in theory,
To hold that
Yes.
position, I feel it.
yes, except you should be using your multifidus. That's what I want to say. Right,
Right.
exactly. But
Don't
right,
even
but
know what
we
that
use,
is.
that's okay. That's all right. That's all right. But you want to use your multifidus instead. And we'll talk about that in just a little bit. Okay. We're going to skip this. We're going to come back to it just because I want to get through some other stuff because it's this is a process that I go with my patients for weeks and weeks and weeks and weeks is learning how to do your breathing, your abdominals, and your pelvic floor. And so if we want to, at the end, we'll come back and do it. But basically, it's practicing this as you sneeze, as you cough, as you speak. A lot of people speak here and create downward pressure. As you yell, as you sing, as you play a musical instrument, as you do all of this stuff, it's practicing this motion and making sure that it's happening during all of those activities. Does that make sense? Yes, so when you jump, as you land, you should exhale and squeeze, right? So inhale, exhale and squeeze, and as you squeeze, the pelvic floor goes up, the abdominal wall goes in, and the pressure goes up. Does that make sense? Okay, but again, it takes timing and practice and often somebody helping you to make sure you're doing it correctly. So, okay, so remind me to come back to this if we want to at the end. Okay, so why do the intra-abdominal pressure control problems happen? Why do people get that downward pressure? Okay, it's because of lack of stability in the pelvis. So like I said, your hips aren't working, other muscles aren't working, your low back's not, your deep low back muscles are not working. And so the diaphragm is a breathing muscle, but it's also a postural muscle. And so the diaphragm's like, oh, I'm just gonna go like this and I'm gonna bear down so that I don't fall over, okay? So that's what happens, is that's why the diaphragm develops this habit. So the reasons for lack of stability are poor posture. We already did that, okay? When you do this, when you stand like this, it loosens up these sacroiliac joints and then your pelvis gets wobbly, okay? So when you stand with a good neutral spine, which we're gonna talk about, it gets those joints super stable and firm. So, but we all stand like this, right? We all stand like this, we carry things like this, we all do this. It's terrible, right? So we're gonna do this. Let me give you some imagery and I just be more aware of this. So, poor hip motor control. So if you have weak hip rotators that go this way and abductors that go this way, then your hips fall inward like this, and that creates pelvic instability, and so then your diaphragm starts taking over. Weak, deep low back muscles. So on the low back, you have your big old spinal muscles here, but right on the bones, right here in your low back, are a bunch of muscles called the multifidus. And they're really tiny, but they're the motor control system. They sense where your body is in space, and if they're not working, then that creates pelvic instability, and then that can create these pressure problems. And then weak foot core muscles. Who's heard of the foot core? All right, we have a slide on that soon, okay? And this is where my dance training comes in. I did modern dance, and so all the time, barefoot, strengthening those arches, strengthening those foot muscles. So if you have weak foot core muscles, same thing. Your arches fall, and then everything falls in, and it creates a lack of stability in your pelvic girdle. So your diaphragm's like, ooh, I have to push down in order to create stability.
Can you fix a weak foot core?
Oh yes. Oh yes. Yes. Okay, we're just going to touch on it. But all right, so those are those 4 reasons that we can get this downward pressure habits, okay? So in order to get rid of those downward pressure habits, you work on all 4 of those things. Okay, so here's what we already started on this with posture. Okay, so everybody stand up. All right, so I want you to picture your tailbone, okay? So your tailbone's here, and all right, so I want you to imagine that you are a dinosaur, and you have a big old long tail, okay? And your tail is there, coming off your tailbone. So feel it if you need to. Feel your tailbone. Ours curve this way a little bit, but picture that they don't. Okay, so you have a tail, okay? So now, flatten your low back. Flatten your low back like this. Where does your tail go?
Between your legs.
Between your feet, right? The tip of your tail would be between your feet. Yes? Okay, now take that tail and lift that tail as high as you can. Where's the end of the tail? It's up in the air. Okay, I want you to picture it being up in the air if you're going all the way that you can, right? Okay, now I want you to find the place halfway in between where your tail is touching the floor, okay? So now your tail's touching the floor. So now, guess what? You have part of your weight on one foot, part of your weight on the other foot, and part of your weight on your tail back there, okay? That is how we should stand. I mean, not like this, but this is spinal neutral. Some people have called it that. I just call it dinosaur tail, okay? Because guess what, okay? Do your normal, okay? And stand on one foot. See how stable you feel. How stable you feel? Stand on another foot. See how stable you feel, okay? Now, go into your dinosaur tail. Put your dinosaur tail back behind you. Picture your dinosaur there, your dinosaur tail helping you, and now lift your foot. Picture that, because guess what? You're not on one foot anymore. You're on 2 points of stability, right? Okay? Did anybody notice the difference? Okay, that's a martial arts thing. They have this tripod of support and they visualize that, okay? And so what it does is it literally puts your joints in the correct position where they're the most stable, right? But it's because of the position of your tailbone and then how that affects you all the way up the spine. Does that make sense? Okay, so that is the other hack that you are going to take home and use now all the time, dinosaur tail, okay? So you're lifting up your bags of groceries. Where's my dinosaur tail? Oops, it's between my feet. Let me get my dinosaur tail back on the floor where it's supposed to be, and now I lift my bags of groceries. Yes? Okay. Same thing. I had a patient who, jumping, always landed with her tail down, tail between her feet, and leaked, right? Dinosaur tail. Your dinosaur tail is behind you on the ground as you jump, okay? So, dinosaur tail gets your tailbone lifted into the correct neutral place, okay? And with it there, then your organs are over your pubic bone, and then they don't move down, okay? All right, okay, you can have a seat, and, okay, so hip motor control, there are lots of exercises that you can do for this, but basically, I just want you to kind of observe yourself, not now, but as you go out, okay? So, when you put your feet kind of hip width apart, you bend your knees, okay? Where do my knees go? Do my knees go here in between my feet? Okay, that means that my hip muscles are not doing their job. Do my knees go directly over my second toes? That's where they're supposed to be, okay? And once again, there can be exceptions based on the kind of the rotational, your bony structure, but the idea is that you're not like this all the time, okay? Because that just perpetuates hip weakness, all right? And so you want your knees to be over your second toes. And if you're exercisers, right, whenever you lunge, where's your knee? Is it here?
Over your toes.
Right? Over your second toe, okay? All the way out here, okay? And that helps build that lateral rotator and abductor strength. So, but there's also tons of stuff on that. Okay, deep low back muscles. All you need to know is if you do your dinosaur tail, you'll be engaging your deep low back muscles, your multifidus, okay? There are exercises you can do, but if it's there, they're gonna be turning on. Your foot core, okay. I wish there's a picture I've seen before of, the sole of the foot, and then it has abs on it, you know what I mean? Like, so I'll add some of these back in, but basically, right, everyone put your hands like this, okay? So, do like this with your hands, okay? We have, I can't remember how many, 28 little tiny muscles in our hands, right? That make the arches of your hands, right? We have the same number of muscles in our feet. And those muscles are what make our foot arches, right? That's what makes our foot arches. And so when you strengthen the foot core, and I'll add some videos in here that kind of show you how to do it, it's going like this, over and over and over and over again. When you're standing, when you're sitting, when you're doing this, when you land and jump, right? Your foot core goes on because if your foot is in an arch like this, then it springs like this. This is your built-in spring. But if it's not, if it's flat, then you just go bam, 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 right? So your foot arches, biomechanics, is a spring. It's a spring. It's like a loaded arch, right? That bends and then recoils like this. So, foot core.
Towel curls?
So that's a great question. So if you watch videos on towel curls, they have you curl your toes like this. And what that does is it uses the long muscles of the leg, the long muscles in the calf. So what you have to do is you have to keep your toes flat and just arch your arch. Does that make sense? So it's a little bit different. You want to keep,
Don't move your toes.
you want to keep this knuckle of your foot on the ground and just, I'm not doing it quite right there, but like that.
Okay.
Instead of going like that. Does that make sense? If you're doing that, that's not foot core. If you're doing this, that's foot core.
Okay.
Does that make sense? Okay. So there are great videos out there, and like I said, I'll add some of the links. Okay, so just going on to breathing a little bit. So we talked about this a little bit, but poor breathing is related to having a tight pelvic floor. So good diaphragmatic movement moves the pelvic floor. We already did that, right? We already said that. Good diaphragmatic movement brings the air into the lower lobes of the lungs. If you're using your chest muscles all the time and breathing like this, it brings the air into the upper lobes, but it doesn't get it into the lower lobes, okay? So it brings it to the lower lobes. Remember that here's the diaphragm, and then you have all of your organs here. Your liver's here, your stomach's here, your large intestine is here. Everything's there. If you are really doing good diaphragmatic breathing, it massages every single organ thousands of times a day, right? So they're getting mushed, blood flow, right? Lymphatic stuff is going back up. So good diaphragm movement is just, your organs love it. Love it, love it. Especially because I'm a pelvic PT, it massages the colon, okay? Colon, down and up, down and up, down and up. And when the colon gets massaged, it's like, oh, I'm gonna wake up and I'm gonna move everything through, okay? So, so most of our patients with a lot of constipation don't breathe, right? And so breathing is really important for good colon function. So there's not one right way to breathe. Our bodies have a wide variety of breathing strategies that are used in different situations. So we just want to be able to do a wide variety depending on the task, okay? So for relaxed breathing, if you're just lying and kind of doing whatever, about 1/3 of the movement happens in the chest. So did you remember that diaphragm video? Did you see how the chest kind of expanded a little bit, right? So about 1/3 of the movement happens in the chest and 2/3 happens in the belly. So diaphragm movement doesn't mean hold your chest stiff, right? So about 1/3 of the movement in the chest and about 2/3 in the belly. Now, I meant to say on exhale. So what I also see a lot is that people can't exhale. Can't exhale without squeezing their abs, okay? So your diaphragm is gonna do its job and push the air out of your lungs. You don't have to add anything with your abdominal wall during quiet, relaxed breathing. Okay, if you're exercising or something or yelling, yes, but relaxed breathing should be quiet and silent, and your abdominal wall muscles should be completely relaxed, okay? Just a couple of general things about breathing health. So we should breathe through our nose with our mouth closed, okay? Your tongue should rest, I've seen two different things, resting on the roof of your mouth or the tip of your tongue resting lightly behind your front teeth, and your teeth are apart, your molars are apart, okay? So that is the relaxed breathing position for a relaxed face, jaw, and mouth. If your tense up here, it's gonna create downward pressure, and guess where it's gonna go? To your pelvic floor, okay? So, like I said, it goes all the way up here, but then it goes all the way up here. What's happening can affect your pelvic floor. Just a couple words about breath and feelings of anxiety, because that's another benefit of good breathing health. So when we feel anxious, what happens? We stop breathing with our diaphragm and we breathe up here with our chest, right? And because of the nerves that are involved and all that type of stuff, that can create anxiety. And it goes both ways, right? Which comes first, anxiety or altered breathing and dysfunctional breathing? they're completely a cycle like this, right? So, so even in clinically diagnosed anxiety, one of the primary strategies is to be mindful of what you're breathing, and in the moment when you're feeling that, you use that incredibly powerful breathing system to alter what's going on in your brain, right? So anyway, it's just a huge, huge, amazing thing that it goes both ways. Okay, just a couple of things on bladder health. So the bladder is a muscular sac, okay? And it's lined with a mucous membrane, kind of like the inside of your mouth, okay? So it's smooth and shiny like that. It has some folds in it to let it expand. But so the female bladders hold about 2 to 2.5 cups of urine. So I picture a Pyrex measuring cup, right? So 2 to 2.5 cups, that's a lot, right? They're awesome. They totally stretch and do this, right? Male bladders hold about 3 cups. Okay, our normal urinary frequency, did I know this until I started in this job? No, I did not. 5 to 8 times per day, but just once every 2 to 3 hours, okay? Norms, you should be able to hold it to 3 hours if you need to, okay? When your bladder fills up about halfway, it squeezes and twitches like this, and that's your first urge to go. You can ignore that one, then the bladder walls relax. In typical situations, then the bladder walls will relax and it fills up more. When it's about 75% full, it twitches again, and your brain is like, oh, that's the second urge to go. If you ignore that one, then the bladder walls will relax and it'll stretch more until about 95% full. It'll twitch again. That's really hard to ignore because it really is full, okay? So there's no such thing as a small bladder. What happens is that you start emptying it too soon, okay? And so then it forgets how to stretch all the way. So always try to avoid just in case urination. Sometimes you have to, but don't make it a habit, okay? Because
that means going to the bathroom every time you walk out the door.
Exactly. Yep. Exactly. So because bladders can develop bad habits pretty easily, but they can also unlearn them very easily. Okay, but just be aware that you just want to train it and make sure that your bladder knows how to stretch to that 95% when you need to, right? Okay, fluid intake, make sure that you're taking 1/2 ounce per pound of your body weight. Bladder irritant intake should, so 2/3 of your fluid intake should be plain water, and unfortunately bladder irritants include anything but plain water, so 2/3 plain water.
Can I have one quick question on
Yeah.
the bladder?
Yeah.
The 3 hours that it should be able to hold, is that the first time you noticed urgency?
No, that would be the third.
No, but three hours from the first,
3 hours from the last time you peed.
oh, I
That
thought
makes
you were
sense.
saying from
No, sorry.
when you felt,
Yeah, no.
Oh,
Like,
just-
yeah, normal is peeing every 2 to 3 hours, right?
Okay.
But you want to be able to stretch it to that 3 hours, ideally.
I thought you were saying hold it 3 hours after
Sorry.
you noticed.
Sorry. Super bladder.
I have a question about the water intake.
Yeah.
The
Yeah.
1/2 ounce per pound of body weight, is that per day?
Yes.
So if I weighed 100 pounds, I should be drinking 50
50
ounces.
ounces. Yep. Yep.
Pass it to Sheriff.
All right, this is just my one little tiny soapbox note. Please use body positive language when children have urine leaks. So please don't call urine leaks accidents, because accident is like emotionally charged, right? With the class that I took about pediatric pelvic floor issues, the instructor was like, you know, somebody called her, I think it was her kid, the school nurse called, your child had an accident. She's like, oh my gosh, they fell off the jungle gym and are dying on the floor. You know what I mean? And they're like, no, she wet her pants, right? And she's like, what? You know, an accident is really emotionally charged. And if the child hears that, they're like, oh, God, right? And we already, you know, we want to create just normal, and everybody has like sometime, right? So you can normalize stuff like that. So that's just one little, tiny little take home.
Well,
So,
what would you say?
oh, you have a leak.
A leak.
A leak. Yeah, it's called a leak.
Even if it's everything.
It's a leak. Yeah.
Really have a big leak.
It's a leak, no matter how much you have to clean up, it's a leak.
So if you are a person who, when you drink water, you have to, within 20 to 30 minutes, you have to empty your bladder because it just goes straight through you. Then should you cut back on the water, or should you just not go when you feel like you have to go?
That's a great
Or
question.
if it's like, I've trained my body not to go because I don't have time to go to the bathroom every 20 minutes.
So right,
I just
so
don't drink water all day long.
right, so you want to use the bathroom every 2 to 3 hours,
Mm-hmm.
right? So the question is, when was the last time you peed? How long has it been, right?
Like if I drink 75 ounces of water, which I try to do, I'd have to go every 20 minutes.
So
It's just
75
like that's all I'm
ounces
doing all day.
in how long of
The
a
whole
period?
day.
Okay, so the goal is to pee once every 2 to 3 hours, right? If you're peeing more often than that, you're not letting your bladder stretch to that 95%. It's forgotten how to stretch to that 95%. Does that make sense?
It's not gonna remember by my wetting myself between here and there.
Right. So this is exactly the type of situation that we work with, and so you can't go from there. You can't go from where you are to here, but so through the therapeutic process, you can retrain your bladder to be able to hold more, not all at once, not in one day,
It's
right?
hopeful.
So no, exactly. So there, people say I have a small bladder. There's no such thing as a small bladder, except if you have a diagnosed condition called interstitial cystitis, where you do literally have inflammation of your bladder lining, and then you get scarring, and you literally have a small bladder. But other than that, there's no such thing as a small bladder. It just has forgotten how to stretch to its full capacity. So, and it can relearn.
Because we've actually heard the opposite, like it's dangerous to hold a full bladder, like it's poison to your body.
Absolutely not. But as long as you have enough fluid intake, if you have really super concentrated urine because you have really bad, right? So once again, there are unique situations that might cause, that might be for your situation, but in general,
it's a lot.
no, you want to have it stretched. Yep.
Is it bad for your bladder to drink more than a half an ounce of liquid?
So if you drink more than that, then you're gonna have to pee more often.
But it's not like bad for it, it's
No.
just, okay.
No, as long as you know that your bladder can stretch full when you need it to, right?
Well, that would be like overnight, right?
Right. If you sleep 8 hours a night, then I mean your urine production slows down at night, but yeah, that's the idea, is that it can stretch to full capacity at night, and so it can do it during the day as well. So,
If you've had interstitial cystitis, does it mean you always have it, or?
That's a great question. Some people think it's an autoimmune condition. It can be caused by a histamine intake and acidic foods and stuff like that. There's a real continuum between. It's a whole range of severity. So if you're in the mid-range, then you can heal from it and go. If you've had it lifelong and your bladder's scarred, then it's harder. You know what I mean? So it's a legitimate condition. So okay, bladder health. Okay, bowel health. Really fast. How it works. So your food goes through your colon, your ascending colon, your transverse colon, your descending colon, and then it goes into your sigmoid colon, which is this S-shaped thing, and then it goes into your rectum. Okay. So under normal, so your rectum is empty. It's just a potential space. When the stool comes from the sigmoid colon into the rectum expands, whoop, and then that's your fecal urge. Okay, that's your urge to poop. Okay, so when you have the urge to poop, the walls are like this. Woo, they're raring to go, right? They're literally contracting like this. So that's that feeling. Okay, but your sphincter's closed, and you wait, and you go, right? So that's how it works. So stool is not normally stored in the rectum unless you have chronic constipation, okay? So it should not be stored in the rectum. It should only come in there when it's ready to come out. So bowel health, the first part, chew your food thoroughly, okay? Because you start digesting there, and then it helps things move through better. Make sure to eat enough fiber and also fermented foods. And actually, yeah, I'll add more stuff on here, but don't sit on the toilet for more than 5 minutes, okay? If you have sat on the toilet for 5 minutes and nothing's coming out, leave and come back again when your rectum, right? Because if you have stool there and then more stool comes in, it's like another train coming into the station, and you'll get that peristalsis again, then you sit back down and go, okay? So you always want to harness that action of the rectum. You never want to strain. Bad, because what happens to your pelvic floor? Okay? Bowel. Vulvar care. So, and I have a lot more on this stuff, but we are about out of time. But I was just gonna say that, and hopefully, I don't know if this is common knowledge, but on your hairless parts, use water only, okay? 100% cotton underwear is the very best. Don't wear leggings day and night. this was the list. I did a class for my 18-year-old and her friends when they went off to college. So take off wet swimsuits and go without underwear if you need to, or sometimes to air things out. And I'll just say, there are, in the past probably 5 years, we now have some really good products on the market for vaginal moisturizers, labial moisturizers. They used to be all just full of crap and chemicals, and there's some really, really good natural-based moisturizers. There's really good lubricant for intercourse, and that kind of matches your body's pH and all that type of stuff. So there's really great stuff out there. If you want any recommendations, and I'll put some ideas in here. Remember, oh yeah,
Sorry, I just have a question on that.
yeah.
So, like my pediatrician told my girls that they should sleep without underwear like a couple nights a week. And she just said that so that like your body's natural flora can kind of do its job and make sure that you're breathing appropriately. So I'm like, okay, that's great. But does that apply to me? And especially when, like, as members of the church, we have a special kind of underwear. How does that all play into it?
So that's a great question, and I would say that it's symptom based. So if you're doing your thing and you never get any yeast infections and you never get, you do your thing, right? If you were in a situation where you're having some symptoms and you have some itching and you have this and right, or chronic conditions, then you need to change something, right? You need to change your diet, you need to change your underwear, you need to go without, you need to whatever, right? And so, and there are always medical exceptions to, garment wear and all that type of stuff. So it's kind of just symptom based, I would say, right? So as a general health practice, for young girls, I've never heard that. That's an interesting thing. So I'll think about that.
I grew up where my mom would not let me wear underwear to bed.
Yeah, because we were wearing nightgowns, right?
Yes, right.
Yeah, those they feel great. I love nightgowns. You know what I mean? You're just So, but that's
even like my
super
girl just in
interesting.
camp, they just have like their loose pants
Yeah,
underwear, and
yeah.
she said that, and I was like pronation infection started at 6.
Okay.
And so I don't think I even asked her, but she just mentioned that, and my girls have never had an issue. Now is that just because they have better genes? I don't know.
I don't know, but
it
also I think it's a great idea because leggings are so ubiquitous, and those girls are in leggings 24/7, right? And so yes, so just because of our clothing culture now, I think that's a great idea, right? So, but once again, I base it on symptoms, right? So, that's just some quick general vulvar care. Okay, so these are the ones in my brain, but breath. So it's a book all about breathing. It changed my life. I was a mouth breather. I mean, sort of. At night, he's like, tape your lips and train yourself to breathe through your nose. And I'm like, oh my gosh, literally amazing. So, but it was just a fantastic book all about breath. The next two are about neuroplasticity and how your brain can change even in really, really severe, interesting conditions. I just love that book. And Explain Pain. We didn't really talk about pain, but there's lots of new research in the past 10 and 15 years about pain and neuroscience, like what is literally happening. We didn't talk about pelvic pain, but there's just some really great stuff, and I'll add some more books there. I'll add some more websites here, but the Foot Collective are the free your, or one of the free your feet guys. And it's just all about, getting your feet strong and flexible and healthy and walking on uneven surfaces and all that type of stuff, and shoes that are shaped like feet and not feet. Yeah.
For the mouth breathing thing.
Oh yeah.
I just know, if you have gingival inflammation that's unexplained, like you're doing the whole oral hygiene thing before you go to bed and your gums are inflamed or sore or red or puffy, it might be from mouth breathing because the saliva is not able to neutralize the acids in your mouth. But if you just get a piece of medical tape and put it from the bottom of your nose to under your chin, and it'll keep your lips together all night, and you'll start breathing through your nose.
Amen.
Of course, if you have a cold, that's
Right. Yeah.
But other than that,
Yeah. So, there was just a fabulous article in the New York Times about mouth breathing, and just 3 days ago, fantastic article. It was actually about bruxism, about grinding. Anyway, but it talked a lot about breathing. So, and that was the end of my slides because that's all I got to. So, any questions? I'm sure there are thousands, and like I said, I know, and these,
Tons of
every single slide, you know what I mean? I went to a 2-day class on constipation and fecal incontinence. I went to a, you know what I mean, prenatal, postpartum, days and days, you know what I mean? These are huge just fields of study. So like I said, this is just barely the surface. So, but anyway, but yes, questions.
Okay.
Yeah.
So talking about like urine incontinence, I found for me when I am doing like jumping jacks or like like jumping apart, that's when I have a problem. Not when I'm jumping up and down. What muscles then in my body are not doing their job properly? Because I will literally have just gone to the bathroom, I'll be just fine. I like start jumping, and 2 seconds later it's a problem.
So that's a detailed question. I want to watch how you jump, and then I can tell you more. So
I just didn't know when you were saying like abductors and everything was different.
Yeah, it's all
so
of
I
it.
didn't know.
It's all of those pieces together. Yeah.
Okay.
So yeah, I'll watch you. Yes.
So I do a cardio dance class,
Yeah.
and there's tons of jumping,
Yes.
which is fine, but
Yes.
when you were saying the arch flexibility, how you're supposed to do the arch with the jumping, right? So twofold, like my instructor always corrects, because I did see a pelvic floor PT.
Oh yeah. Okay.
And she always corrects me, my dance instructor, and says, tuck the hips, when I'm like not tucking my hips, you know? So.
And that's why, just gonna say, I cannot stand bar technique. Okay, so a lot of people love bar. It's terrible because they teach you to go like
They
this,
do.
right?
Like Amy, she calls me out.
And old school Pilates, and old school Pilates teaches you to do this, and newer Pilates teaches you to do this. But yeah, it's all yes.
But so how? Because I'm wearing these shoes when I'm dancing.
Yes.
How do I do that arch thing where I'm contracting while I'm jumping?
Right. So that's a great question. So when you're building your foot core, it's not something that you do with each landing. When you build your foot core, your arch, the muscles start getting shorter like this, and all of a sudden you have a spring, and then it'll happen automatically.
Okay, so there are
Does that make
exercises
sense?
that I do when I'm not dancing.
Exactly. So that said, when you land, and this is a modern dance thing, when you take off, you grip the floor with your feet and come up, and then as you come, you're controlling and you have a silent landing, and that means that your foot core is working. Does that make sense?
Yeah.
But this is something that you do to build your arch, your subconscious level of arch. Does that make sense?
Yeah.
Okay.
Thank you.
Yeah.
So does a pelvic floor PT typically work under the umbrella of the OBGYN or under physical therapy or?
So we're independent practitioners. So physical therapy, that's a loaded question. In California, you have to have a physician's prescription to treat, except we can do it for 45 days without a prescription. It's ridiculous. Anyway, so we work under, a doctor has to refer you. It's like any other physical therapy, it's just a special part of the body. So insurance covers it, it's not a special
So
thing.
it's a physical
It's just,
therapy office separate from a separate practice from, like, you wouldn't be working under scripts or something?
well, so I work at a private practice, and so we get referrals from all over. At most of the hospitals now, they have a pelvic PT in the outpatient clinic at the hospitals.
Okay.
So, so there's a variety of places where you can go.
I see.
So yeah, it's all the same billing, it's all the same insurance coverage, it's just a specialized area of the body.
They have private practices also that I didn't have to have a prescription.
Yeah.
They are, that is not
They're
correct,
in the law?
that is not ethical in the state of California, yeah. So yeah, you have to have a prescription, yeah, so. But at the same time, some movement therapists and body workers do this type of stuff, and it's not physical therapy, but it's the same movement, you know what I mean? These principles apply whether it's a PT or a body worker or a kinesiologist or whatever, right? So, but you can't practice physical therapy without, anyway, complicated subject, but.
Question.
Yeah.
What happens if you have a pelvic collapse?
So, excuse me. Do you mean prolapse?
Prolapse, but like after I had my daughter, they said I was in pain for probably 6 months because I didn't have muscle, like my muscle atrophied when I had her. So it's better now, but will these exercises help that?
So I haven't ever heard the term collapse. So do you mean an avulsion? Did you have an avulsion where your muscles tore away from the bone?
I don't know.
Okay.
I'm not sure.
That's what it sounds like. So, so in some cases over here, so the muscle can tear away from the bone, and then you have some laxity in there, and then gradually it'll kind of fibrose and kind of heal back together. You can have a surgically repaired if you have to, but yeah, you can kind of do that. So that's I think what it sounds like. I haven't exactly heard that term. So yes, but so the question is, it's not what you have, it's what you do with what you have. So the answer is yes. So all of this will help no matter what, no matter what your structure is, right? And we can all improve our function no matter what our structure is. So yeah. All right, yeah.
Where can I find some resources for good like pelvic stretches, like for your hips, if you feel your hips are really tight?
Oh, so I don't have specific places, but I mean, yoga. Yoga is fabulous. Yoga is fabulous at getting all of those things. The best stretches to stretch your pelvic floor are full squats, but hanging on a door, like hanging on a doorknob, like this. Like you don't want to be holding yourself up, right? So like this, because it opens those sits bones, right? So any stretches that open up your sits bone, and any stretches that open up your pubic bone and tailbone. This is easier, but
Does Happy Baby do that too?
Happy Baby is wonderful. Yep, and deep squat, and deep squat, but hanging squat, and child's pose, and child's pose with your hips rotated. So, but there's all sorts of really good stuff.
So you just kind of hang in that position?
So yeah, cause see my sits bones, and they open up when I go like this. So it's stretching it this way. So that's good, but you have to be hanging. You can't be holding it up with the muscle has to be relaxed, right? And stretch. So and then child's pose is kind of the same idea, but you're.
So then what separates it the other direction?
Like I said, that's a little harder. But whenever you lift your dinosaur tail like this, it can stretch. Well, it's complicated, but yeah. When you keep your pubic bones stable and kind of move your sacrum like this, it can stretch it. And any stretches like this, right? You're gonna open it up this way, right? So in anything where you're really opening your legs, because that's
like warrior two.
Yeah, exactly. Yoga is just so wonderful for whole body strengthening, stretching, and dexterity, right? So yeah, good. All right, yeah.
I have two quick questions.
Yeah.
40 years ago, the big thing was Kegel exercises.
Yep.
Is that still popular?
So yeah, okay, so Kegel's is Dr. Kegel, an OBGYN who didn't discover, we've had pelvic floors forever, right? So, of course he put his name on it, right? He invented it, right? So Kegel is just a pelvic floor squeeze, that's it, that's all it is. So you squeeze and lift your anus and relax, squeeze and lift your vagina and relax. That is a Kegel, okay? And that's all it is. Squeezing and relaxing, squeezing and relaxing. That's Kegels. So, Kegels, great. What's even better? Controlling is the coordination piece, right? And the relaxation piece. Relaxing, 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 relaxing. Let me answer the question of why strength is not that important. So, pelvic floor strength is measured from here and how high it goes up. Okay, so if you live up here and you're like, oh, I'm going to test my strength, you go, ooh, ooh, ooh. Guess what? I don't have very much strength. If you learn how to relax, you go like this, and then you squeeze, and you're like, oh, guess what? My strength came back. Okay, so strength is all about the length of the muscle and how much it moves up and down. Okay. Now there are extreme things, so you can get vaginal weights and you can hang weights and you can do resistance training. You don't need to do that for normal function, okay? So if you relax your muscles, your strength will come back, except in unique conditions, right? There's some unique conditions, but yeah.
I've had conflicting advice from professionals about that issue of Kegels.
Yeah.
And some have said do the elevator thing where you feel yourself getting tighter, and slowly go back down again. And some say to do that while you're urinating to stop the flow. And then others say, no, you don't want to do that because that will introduce bacteria to your bladder. So what's your thoughts on that?
So that's a great question. So what I typically say is You should not squeeze while you pee as a strength test, except one time per month, okay? So if you do it once per month to check your strength, great. If you do it more often than that, remember how your bladder gets bad habits very easily? So what happens when you pee is that your bladder is squeezing and your sphincter is opening, right? So you have this coordination that goes like this. Bladder squeezes, sphincter opens, bladder squeezes, sphincter opens. If your bladder is contracting, it's involuntary, and you keep squeezing it here, your bladder's like, what are you doing? It's getting the wrong signal to your bladder walls, right? And so if you do that a lot, it can mess up your normal voiding reflex, what's going on in your brain. Does that make sense?
Yeah.
But once a month is a strength test, okay. So
But that's not something you do to strengthen your
you do it when
bladder
you're not
control.
when you're not peeing.
Right.
When you're not peeing,
Yeah.
yes, but not when you're peeing.
Okay.
Yeah. Does that make sense? Okay. Yeah, great.
So, I feel like when I have done Kegels, however
Yep.
you say it, I actually have worse leaking. So what is that? Why is that?
That is you teach the exercise class, right?
Yes.
Yeah. So just knowing that, we got all sorts of wonderful, fabulous fit exercise gals. Pelvic floors are way too tight, and upper abdominals are way too tight. Okay, and so it creates those pressure problems, right? So I would put money that your pelvic floor is tight, right?
It's too, okay, so it's
Uh-huh.
too tight.
Yeah,
So how do
exactly.
you relax
And
it?
right, what?
So then how do you relax it? You keep saying relax it, but I'm like, how do I relax? Like
This.
everything.
All day long.
Breathing.
You get your diaphragm moving. That's what moves your pelvic floor. Your diaphragm moves your pelvic floor. That's it.
Okay,
That's
so
it.
it's not like there's anything else that's special. It's
But
breathe.
but remember, if you're not breathing, that's thousands of times a day, right?
Yeah.
What you breathe 1,100 times a day, right? If you retrain your brain to do this, then guess what? 1,000 times a day, your pelvic floor is moving up and down, right? That's a relaxed pelvic floor. When you tie it into your breathing, right? You can't force it. You cannot force relaxation, right? You can only invite relaxation, right? So, does that make sense? So,
And this is in.
Yeah.
In, right?
Turn your bottom hand the other way. So, because remember, this is a dome this way, So, like this, it's like a piston. It goes down and up. So, inhale this way, exhale this way.
So we
Inhale this way.
Your pelvic floor.
And you can do that in your car. You can do that on your ball. You can do it on a towel. You can do it feeling your muscles. Feel your muscles. Feel, are they moving down as you inhale, right? That's what you want. Yeah.
Katherine, do you see many elderly patients? I'm thinking how to support elderly
Yeah.
family members. Is
Yeah.
there hope, or is it get to a point where it's just?
So that's a great question. I mean, yes, we see all sorts of elderly patients. How much they progress really depends on their cognitive awareness, because you, like I said, you have to be aware of the movement pattern, you have to practice it, and then you have to change how you move, right? So it really depends on their cognitive capacity. That said, one of the pioneers of pelvic health PT in the U.S. was named Janet Holm, and she didn't start with pelvic floor. She started with teaching people in nursing homes how to strengthen their hips like this to get them walking better, and all of a sudden they stop leaking.
Wow.
So this, remember that weakness in the rotator muscles, like this. She calls it the rotator cuff of the pelvis. And when they strengthened this, all of a sudden their pelvic floor started working again, and they stopped leaking. So that's the easiest thing to do with elderly people, is to strengthen their hip rotation and their hips in general, because they're super weak, right?
Do you have to make
So-
sure
Standing
you're,
or sitting?
Yeah.
do you have to make sure you're breathing correctly while you're doing that, or it won't help?
That's an advanced skill. If you can, great, but if not, doesn't matter.
It still helps.
It still helps.
Okay.
Yeah, still helps. So, yeah. Standing is the best, but for elderly
If they're
people,
wheelchair bound or something.
yeah, then you do it sitting. Yeah. You put a TheraBand there and you, so, yeah. That's a good question. So,
I have a question about that.
oh,
Yeah, if it's crossing your legs all the time, going to inhibit that kind of movement, if you're always got to have your legs crossed.
oh my gosh, you asked. Okay, are we still okay, guys? Okay.
Yes, it seems like that would just be making it worse, huh?
So I should sit like this?
Thank you. Okay, so here's, so we're going to pelvic health 201, okay, so, all right, that's okay. So, all right, So everybody go like this, okay? So, how many of us sit like that? Right, and hang like this, right? Okay, so you can cross your legs and have this medial or internal rotation and cross your legs like that. Bad, 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 okay? Or you can be here, or you can be here, and you can have your legs like this and cross your legs. That's fine. Or you can be here and cross your legs. That's fine. But this, not fine. Not fine.
But when it naturally like pulls your leg in,
Use your muscle. Yeah, that.
well, that's hard.
I know, because you have weak hip rotators and you're not used to using them. You're right. This is your habit, right? This is your habit like this, right? So, so yeah. So just think open, right? And that's okay. Now I'm on my soapbox. Okay, so that's part of the whole shame thing, right? We're like this. We're closing, right? How do guys sit? Guys sit like this, right? Right? Okay? So, this, right? This is a position of hip and
Because I'm trying to
building.
present this like
power.
we need that extra space.
Right. But also, right? It's hips, it's strength, right? And then we see, right? We see models on the runway like this of dainty feminine, right? Drives me insane, right? This is a disempowering position, physically and mentally and emotionally. This and this, right? So anyway, my soapbox over. Okay. Yeah. Hey, Mark.